So, hello everyone. We've had an amazing day up until now. We'll do introductions later before the item begins, but we'll go through housekeeping first, which has to be done. So we're not expecting a fire practice. If the alarm sounds, can all present leave the building as quickly as possible by way of the nearest exit? And the designated assembly point is in the public square in front of Cast, beyond the fountain and away from the civic office. If there's anybody with mobility issues, please wait in the refuge area at the top of the stairs where the emergency evacuation lift is located, and use the intercom situated to the left-hand side of the lift doors to call for assistance. There will be no roll call. Mobile phones, we've all got them, so would everyone just make sure that it's switched to silent mode, please? And this meeting will be audio-visually recorded and will be available to view on the Council's website and YouTube channel. Can I ask all those present to use their microphones to ensure the audio can be captured, and remember to switch it off when you've finished. Okay. Any members of the public entering the council chamber are accepting that their images will be retained and broadcast by the council. So any member of the public or press is intending to record or film any part of today's meeting, please ensure that this does not disturb the conduct of the meeting. And if you are visually recording, you're requested to only focus on that recording. So we'll go to our agenda, and do we have any apologies for absence?
Councillor Sue.
Okay. And we need to consider the extent, if any, to which the public and press are to be excluded. I don't think we have any. And are there any declarations of interest? So if you have an interest, please declare this, and a form will need to be completed following the meeting. Please contact Caroline, who can assist you with the process. So we have the minutes of the last meeting, and they will be passed shortly. Public statements, we haven't got any members of the public, so we aren't going to have any of those. Right, okay, yes. Can I have an approval on the minutes of the last meeting, please? Thank you. So we have no items. Yep. Right. So I'm going to now, if we introduce ourselves first, and then we go over there to our big group. So we look a bit equal this time, don't we? Which is wonderful. So if we start with Martin. Yeah.
Good afternoon. Martin Greenhouse, ward member for Tickhill and Wadworth. Thank you.
So I'm Glynis Smith, I'm the chair of this meeting, and I'm a Hatfield ward councillor.
Caroline Martin, Senior Governance Officer supporting this meeting today.
Councillor Bev Chapman for the Mexborough ward.
Councillor Linda Curran for the Hatfield ward.
I'm Councillor Ken Guest, I represent Rosington and Porty ward.
Councillor Laura Bluff for Bessica ward.
Councillor Yetunde for Whitley Intake and Cleanling ward.
Hello, I'm Rachel Leslie. I'm Director of Public Health at City of Doncaster Council.
Yeah, and I'm Helen Conroy. I'm a public health lead for supporting resilience and improving lives at Doncaster Council.
I'm Jo Jepson, Chief Executive at Project 6.
Hi, I'm Elise Green, Deputy Director of Operations for Project 6.
Hi, I'm Ben Goundry, Project Lead for Project 6 Doncaster.
Hi, Lauren Beaumont, Public Health Improvement Officer in Supporting Resilience and Improving Lives team.
Hi everybody, Andy Collins, Public Health. I have a particular responsibility and remit to reducing alcohol-related harm in Doncaster.
Hello, Andrew Vincent, Drug and Alcohol Service Manager within Aspire.
Hello, Tim Young, Chief Executive of ADS, who is one half of the partnership that supports Aspire.
Kate Watkins, I'm a Service Manager at Zone 5 to 19. Rachel's got a technical difficulty.
It's not working. Hello, I'm Rachel Grant. I'm Team Lead for Zone 5 to 19.
Switch my microphone on first. So before Rachel starts, I just wanted to really mention and make some observations about the site visit this morning, which we all enjoyed very much. So I'd just like to briefly read the observations, and then Rachel, you can give us the quick run through. So our observations were around detox was considered very important before treatment, but structure and routine vital moving forward. We heard about background stories and impact of addiction, such as with work, family, friends and relationships. We spoke about treatment and next steps leading to possible training opportunities and becoming a volunteer and mentor with Project 6. The Project 6 building was considered as a safe environment that helps report recovery. And Project 6 individuals commented that it had provided them with a community-type environment and connections that were considered very important in terms of the support provided. And I'd just like to say I felt we learnt a lot about you through the engagement this morning that was so positive. And personally, I was at 2 of the events, your engagement events, and had an amazing time. And I think, you know, it's testament to the fact that you're out there in the community telling people what you do. Okay.
Thank you, Councillor Smith. I'm sure that's very welcome feedback for those that prepared for the day. I can see lots of nods behind me. So this overview and scrutiny panel will run a little bit differently to our previous ones, and thank you to the Chair and Vice Chair for allowing us to plan something a little bit different. So what we haven't got is a slide set this time. Instead, we offered the visit to the Sober Social setting. Thank you to those that could make it. I know not everybody could, but it sounds like you've had a chance to catch up and share your experiences from that. And huge thanks again to colleagues that arranged that. I did warn Councillor Smith that there was a long report coming to you, so we've written that as a consortium, as a set, as a partnership. So each of the people on this side of the room today have contributed to a section of that report. So it is comprehensive because there's been a lot going on in the world of substance use over the last few years. So in our report, we've described the new service. So the service came up for re-looking at, for reconsidering around about a year ago. And we were working with the existing service. So Aspire, you've got Andrew and Tim just to the side of me here, and we worked with them collaboratively, using the voice that we had from people that use substance services or want to use substance services to shape what feels like a much more compassionate approach. And hopefully within the report that you've received, you'll see that the service is running that bit more flexibly and that bit more tailored to the different lives that people could benefit from the service are experiencing. Zone 5 to 19, the colleagues on the row just behind me sharing the microphone, run that integrated service alongside school nursing that has a focus for young people who use or are concerned about cigarettes, also included in there, alcohol or substances, and that includes vapes as well. Also, over the last 3 years, there was a publication of a national drug strategy, and along with that came additional funding for local authorities in the form of a supplemental substance misuse grant. So this is, as far as we currently know, a fixed term amount of funding, which was originally planned to finish this year. We're hoping, expecting that there may be recurrent funding beyond this year, but we don't yet know the details around that. Using that funding, we've been able to work as a combating drugs partnership, so another thing that we've had to establish and set up around priority areas, around supply, around breaking supply chains, so working with police colleagues around there, improving treatment services, so our Aspire services, and also breaking that demand, so more of the focus on children and young people. And through that Combating Drugs Partnership, we've been able to plan with partners where to invest that significant additional funding. And where you've been and what you visited and what you read in the report is a result both of the core funding, so that will remain, that's funded through the Public Health Ring Fence grant, but also significant supplemental funds over the last 3 years. I did include in the report towards the very end, so we have to report how we're doing to OHID, the Office of Health Improvement and Disparities, and they then report around the funding that's been allocated, and I included a statement from them about how they view and see Doncaster's progress, and hopefully through the rest of the content of the report you've been able to read that as well. So I think that's everything for me to share with you today. Again, thanks for those that were able to attend and visit the service. I know Sober Social this morning. I know that the team also extended broader welcome opportunities as well. So if you weren't able to make it today, there's drop-in opportunities, and those that were there really generously shared their experiences with us as officers and with partners and with you as panel members as well. So that's everything I've got as introduction. I think you've got some questions for us today. Thank
you. And I'm going to start. So there's discussion around a full physical health assessment, which is comprehensive and with prescribing interventions arranged for the same day, which is brilliant. If treatment is required for health conditions, where does this sit in the system as it currently is?
I think the principle that underpins it is we don't try and attempt to be all things to all people. And part of supporting recovery is trying to help people access the same support systems as everyone else. So whilst it can sound a bit clunky, that's the rationale underneath it. So we will identify, but then at times refer on to other existing specialist services. So I know we refer to the Hep C service, for instance, and again, it's that there's an undercurrent of, I suppose, social justice in there, in an excluded group, trying to help them rejoin the community.
Were the follow-ups, and is HIV testing part of the initial kind of tests that are done?
So we do, when we do the dry blood test, it does look at HIV and it looks Hep C, but again, because we're not a service that can action that, what we would do is refer to the sexual health service or the Hep C trust, as Tim says. So we do have those pathways in, and some of our nurses have worked in those services before, so that they do know the system. So we would refer on to services, and sometimes the key workers might support the clients to get to those appointments as well.
Our next question is from Councillor Alabon.
So just to add, so if a person presents to the service, it's likely, or often you'll find that they might have physical or mental health needs as well. So I think the process that happens is an overall assessment that then allows the service to identify what other kind of care that person might need. So some individuals might need wound care treatment, some might have another underlying condition as well. What a substance misuse service can't do is in-house provide all of those healthcare elements, and the service and the functions are there outside. So Tim and Andrew are describing there the links that they have with other existing services. So not just a signposting to, but an actual supporting people to access those elements of service as well for that holistic healthcare of the individual.
Thank you, Chair. Thank you, Rachel, and the team. It's a fantastic opportunity to be able to join the session of this morning, and I'll encourage everybody to go in for the drop-ins if you haven't. What Rachel didn't tell you was that on a Friday afternoon, there's usually cake thrown in. So if you don't want to go for anything else, cakes are available. I was informed of that. I hope that's still the case. Thank you so much for the hard work. So I've got two questions in quick succession. I'm going to take the first one, which you've probably partly answered. This is regarding the routes and ways of monitoring when clients tested positive. So I'm just wondering, do they get to go to the GU Med, general practice, I can see Rachel is already raising her hand. So yeah, if you want to answer that question, thank you.
Yes, I don't want to pinch anybody's limelight, but yeah, from what I understand, if on the test that's done, if somebody tests positive for either hepatitis or for HIV, so we have, again, a sexual health service in Doncaster, so we have Solutions for Health, which I expect you've got good connections with as well. So there would be a referral to those specialist sexual health services or to hepatitis response treatment services. I'll just check if you want to add anything to that, Andrew.
Thank you very much. And is it okay, Chair? Can I ask the next question? Okay, thank you. So my next question is regarding the OAT team assessment program. I'm just thinking of the rationale behind the 38 planned assessment per week. Because when I saw the figure, the number attached, I'm thinking, are we hitting a target? Is there a KPI? Is this the max? Are we average? Can we scale this up? So I just want to know what's the rationale behind that figure. Thank you.
Yes, great question. It is part of the national strategy, and the fundamental shift of that is to increase capacity and increase quality. So that means more staff providing more person-centred, responsive, high-quality care. So to do that, we've, not an easy task, but we've recruited more staff because this has been going on nationally all across the country, looking to increase capacity. So linked to that national direction, we do have a suite of key performance indicators. But this particular 38 assessments is not a performance indicator. We haven't said, oh, you must have 38 assessments. We just said, well, more staff, more people in the treatment system. So having that number of assessments as a calculation of the capacity enables the front door, which is people to get in more quickly and more easily with less steps from a service user's point of view. So it's much more timely. So it contributes to an overall suite of key performance indicators, but it isn't a particular indicator in itself. And Andrea will explain how that figure's come about.
Yeah, so in terms of what the staff do, so we'll have case managers in that team. We've got a physical health nurse, and we've got non-medical prescribers that are attached to that service. So what we've done is when we look at the diaries and the work that they can do in a day, we'll like match, you know, what assessments can they do, how long will it take to do a really good assessment, then offer them a physical health assessment, and then perhaps write them a script on that day so they can take it away with them, so we can like see someone that day and get them started on treatment. So what we've done is we've looked at the rotas, how many staff we've got, what the working hours are, and that's how we've come to the figure of how many assessments we should be able to do, but complete good solid assessments within a week.
Thank you.
Could I just add as well, I think the other thing not to miss is the 19 walk-in assessments that are available. And that's really about us understanding that the cohort of people that we offer services to are likely to have multiple and complex needs. And in those sorts of situations, if you're not stable in your life, noting and then keeping an appointment, that's maybe not your strong point. But working from the principle of every contact counts, if they walk in and we can immediately do the assessment that they need, get a good take, and actually give them something tangible to take away with them. So if you get something tangible from visiting someone, you're more likely to go back. So there's that sort of thought that's gone into why we would go for these walk-in ones.
Thank you very much.
Right. Now we come to the criminal justice system, point 20. And I wondered, does this prisoner release engagement show substantial increases? Has there been affected by early release of prisoners?
Do you want to go first?
Yeah, no, I'll go first. So yeah, you will have seen in the news and heard that there's been arrangements for some early prison releases. For Doncaster, that's been a pretty small number. We've got the numbers that we can share as well. Probation services brought partners together, so that included us, Public Health, us as commissioners, and the service, us in Tim and Andrea as well, to look at the various realm of preparations that would be required to support prisoners being released early. Through that, we heard about the establishment of the departure lounge and how that would respond and support prisoners that were being released. We also we asked a few questions of assurance around harm reduction as well. So those prisoners that might have been not free for a period of time, then what were the things we needed them to be sure to be really certain of, particularly around the synthetic opioids. So I think it was a positive process in the preparations. It perhaps be a little bit too early to know the full impact, but Aspire colleagues might be able to share some of that as well.
Yeah, I think as Rachel said, we did sort of link in with probation around getting the criminal justice teams to the departure lounges, and I think that has worked quite well. As Rachel says, we won't be able to know the full impact of it, but I think we have worked, quite closely with partners to make sure that on release that prisoners do get a good service and get sent, leave with something again, so that they're prepared for the outside world.
Thank you for that, and thank you for asking my question. So the next question's from Councillor Curran.
Thank you. Can I just apologise for this morning? I wasn't able to attend, so I will apologise for that. The outreach team figures, can you provide more clarification? The figure of 105, what does 105 figures represent as a percentage of homeless people in Doncaster? And how has contact been made? Thank you.
So just to say about the outreach team, although they do work with homeless people, it's not the only group or groups of people that the outreach team would work with. So it wouldn't be all homeless people. There would be sex workers, perhaps people who live in hostels, perhaps with more complex needs. And so that outreach team has got quite a wide remit. There is also an Aspire worker embedded in the Complex Lives team, in the council's outreach team that works with homeless people. So there's a lot of cross-linkage. But I think Andrea and Tim will be able to give more insight into the numbers in terms of the proportion of people that they're likely to see on the outreach team who are homeless.
So when we've looked at what we currently, who we're currently working with, we have had 105 clients in the past. We're currently working with 63 clients, and out of those, 10 of them are actually homeless, so of no fixed abode, so that's 15% of the cohort currently. But the team make contact by going out on the streets. They do daily visits out on the streets to see people. They frequent hostels and areas where we know that people might be sort of congregating with the peers. We also link in with partner agencies like Changing Life, Complex Lives, and share information. If someone we've not seen for a while, and we'll ask, have you seen so-and-so? Do we know, are they okay? Where are they? So we can sort of get out to see them. We do drop-ins at Princess House as well, because as Tim said earlier, some of our clients, they might not have a watch or a phone, they don't know what time it is, but we have drop-ins so that they can just drop in and get some support, get a cup of tea and an assessment and support if they need. And we're currently trialling a 5 a.m. walk as well. One of the outreach workers is currently going out at 5 o'clock in the morning to sort of catch up with some of the sex workers that might be out in town. So we are looking at sort of some trialling some early mornings and late evenings, but obviously it is at the minute just a trial, because obviously we have to, we work within a certain budget, but the team are always out and about trying to sort of engage with the clients outside rather than trying to bring them in if they don't want to come into the buildings.
See if I can ask this question. So this is older persons alcohol services. Point 34. I'm really interested in the links with housing associations. Obviously, in Doncaster, we have our biggest provider, but I'm also aware that there are smaller providers coming through, and the possibility of maybe many more in the future. Is contact with these smaller providers part of a forward plan? And I'm asking that because of my personal experience, not all positive, and this needs to be established before tenants are in place.
Yeah, thank you. So we, our older persons alcohol service at Project 6, we have got links with some housing organisations already. So they are listed, but I'll go through them anyway. So there's Riverside, South Yorkshire Housing, Garnham House, Ashcroft House and St Ledger Homes are all organisations who we do get referrals from and who we do have links with. Referrals can be limited. And the older persons alcohol service that we provide at Project 6 until this year was a one-man operation. So Danny, who works on the service, although he does a fantastic job, he is only one person and holds a full caseload. And so while he's able to make time to go and make those connections and make those links with other organisations, what we found this year, because we've had a little bit more money for that service and we've been able to add a second worker to the team, they've actually been able to do much more contact and communication with other organisations, including the housing providers that are listed on our answer sheet. So Sophia, the new worker on that service, has got plans to, and I think she started actually, but she's got plans to go into team meetings to introduce a service that we provide and to make those connections stronger. So it's a bit of a watch this space answer, but yes, that's something that we've got links with already, but we're further developing.
Thank you, Chair. So my question is around services for young people from point 24. I'm going to read it out because multiple questions kind of roll into one day. So talk about support for drugs, alcohol, and tobacco concern and use. Does this include the use of vapes? It seems clear driving or walking past schools that vapes among young people are readily available and being marketed especially to appeal to children. Some children who vape have never smoked, and some premises appear happy to sell this product to children in school uniform. Has also been reported that some illegal vapes contain illicit substances. Is this a concern as well as part of the service? Thank you.
So if I just start, and then zone 5 to 19 colleagues will talk about how they support young people around vapes and other elements of service as well. So we are anticipating some national legislation that will tighten the restrictions around vapes, the availability, flavours, packaging for young people. You'll perhaps remember that this was initiated under the previous government, and we are expecting, hoping, anticipating that a similar set of legislation will be proposed as well under the current government. There was a consultation that happened around young people and vaping, which we feel made the compelling case around that. Before I pass over to zone 5 to 19, just to describe, there's lots of us on this side, and it's one part of the world, but another part of council functions as well is around our trading standards colleagues. So they will also go in and will have operations around either underage sales or around illicit tobacco and vape products as well. So as well as all of us here talking about these elements of services, there's other parts of the council as well that will act and respond to things like illicit tobacco. So I'll just check behind me for zone 5 to 19 colleagues.
Hello. So just to start with, I think I would just like to express that we share some of the same concerns as what you've raised in your initial question. And we do agree that there are probably some shops out there that are selling vapes to people in school uniforms. As professionals, as a service, wherever we would identify that information, then we'd always share that with partners, police, public health, and pass that on, try and prevent that from occurring. But it is absolutely a problem. We also agree that manufacturers of vapes are targeting this population with very cheap appliances, vapes with whistles on, lights and funky flavours and everything else. And it's very challenging, to get around that attraction. But we've got a whole raft of ways that we utilise to try and educate young people, education settings, anybody involved or working with a young person. From a zone 5 to 19 point of view, our support package starts from the minute that they walk through that door. We provide education to all young people in terms of brief intervention, but also in terms of through a holistic health assessment of need. So there is general advice right through to one-to-one intervention and support when that's required and wanted. In respect to education sessions within schools and our offer to colleges, etc., We ensure that they're equipped with brief intervention information so that they can have some of those conversations as well in a timely and appropriate manner. We also recognise that young people are choosing to vape even before they've started or ever tried a cigarette. We offer education around that and try and promote, well, not promote, but encourage the use of vapes as a means to stop smoking rather than an activity that a young person chooses to engage in for fun, because ultimately quite a lot of this is fun and habitual. Other things that we do is education and advice to parents and carers through our single point of contact, through parents' evenings in schools. As a service, we have not had any referrals for cases around illicit substances, but if we ever get such, or if we have schools that are concerned that that might be a possibility, then we work really closely with schools to support them around having those conversations with that young people, or we'll go in and do interventions with a group of young people that we're concerned about. The work that we undertake includes information with respect to the law, with respect to risks around buying of vapes, particularly online. And as I said previously, if we've got any intelligence around how a young person is able to access these vapes, then we always pass that information on. The Tobacco Control Alliance also consider the impact of vapes. Members of the team are providing resources to school also and to wider settings to support and tackle this issue.
Thank you very much.
Right, we've got a question now from Councillor Greenhill.
Yes, regarding treatment pathways. The young people receive a comprehensive specialist substance misuse assessment as part of the holistic assessment. What are the referral routes for the young people?
Okay, so there are many ways that young people can contact and access our service. Sort of our ethos is no door is the wrong door. They can access us however they want. The main routes we would suggest are they can call, they can text, they can access us via an online e-clinic, or they can contact us via social media platforms. And then we have a base at the Flying Scotsman Centre where they can walk in or they can make appointments. All secondary schools have drop-ins that are held every 2 weeks that young people can attend. And then we offer one-to-one support and specialist interventions in a range of settings, such as primary schools, alternate education settings and other community venues, such as the young people's homes. Parents, carers and professionals can refer through our single point of contact via phone or email in a referral form that's completed with the consent of the young person. And then the referral is triaged by a nurse and then contact is made within 5 working days for substance misuse support, or sooner if it's high risk and it's deemed necessary. We have outreach workers that go out and meet young people, and peer support worker now who goes out and looks at engagement. So wherever we can find a young person who we think could do with support, we will try our hardest to signpost them to our own service.
Yes, thank you for that. I just wondered, do you emphasise the need for, let's say, a very low-profile approach? A lot of younger people that I've come across with problems, especially the parents, have told me that they just wanted to hide it from people, and that's why they didn't want to come forward. I just wondered if you have any secure, quieter pathway to go into that.
I think the idea is to get our service out there and known so that people know how they can access us. We're known as a safe haven. We do have people just dropping in for different health reasons, just because they know that Zone 5 to 19 is there and we can support them. We've been to sort of youth clubs, talking to young people out on the street. We do we're based in the interchange, catching people as they're coming in through buses, where we'll give them a card and they might just know us as his own, but then that just triggers them that if they need that support with someone confidential that they can come and talk to.
I'd like to also add that we try and influence people through discussion. You know, they don't have to have come to this service just for advice on vapes. It could be for a whole raft of different reasons. We're not just a substance misuse service. There's also a school nursing function, a contraception and sexual health function. So irrelevant on who you talk to, if they think it's an appropriate conversation to be had, they'll slip that into some generic conversation to take the pressure out of that situation.
Thank you. That's very nice. Thanks.
Yeah, thanks very much for this morning. Absolutely fantastic. Really enjoyed it. Great to get some stories. Just so inspirational. The service users, absolutely amazing. Thank you. Just to come back to the work that you do with the youngsters, I've got 2 children, year 6 and year 3 now. My year 6 is obviously going up to high school next year, and that's a daunting thing for me. The children that I see, I do a lot of work in school. I go in and volunteer and I'm quite hands-on. I see a lot of the children who have gone up to high school now with vapes in the hands, cigarettes. Is there any specialist work that you do with year 6 before they make that transition to high school, please?
So every school in Doncaster has a school health profile, and that is discussed annually with the local school nurse, and every year they'll agree on what their priorities are for that school. So not every child in year 6 is going to have that typical discussion. However, if school have recognised that is a problem and they choose that to be a focus, or if they've got particular concerns relating to specific children, then our service would absolutely go in and deliver packages of care around that. But it's not a universal offer to all year 6 pupils.
I can't find the precise detail, but we'll get it to you. If Simon was here, who's the Commissioner of the service, she may well share some of the broader work that the HDRC, the Health Determinants Research Collaboration that have been doing around vapes and young people. So if I gather that up, we can offer that as a bit of a follow-up. So we're continually looking at new things that can make improvements, particularly around this, which is such a changing area. Health behaviours often change at a much more rapid pace than things like policy can and will change. So I'll have a look, check in with Simon, and there might be something additional that we want to add just around that research type approach that we've taken too.
Thank you, Chair. My last question. Okay, so this is around EPIC, the Encouraging Potential Inspiring Change. I read in the reports that there is a pop-up youth zone in the French Gate shopping center. And this is the first time I would read about something like this. So I was just wondering how this is promoted, maybe because I'm not a young person. That's why I didn't know of it before. So just wondering how this is promoted, just to make sure it cuts across the necessary people that needs it. And also, if you have any information about the way young people have been responding to the new approach, have you noticed any changes? How have they been responding to it? Thank you very much.
So, from a Zone 5 to 19 perspective, we've got some really good, strong, collaborative working relationships with Team EPIC. We are regularly in attendance in that venue, offering our support, specialist knowledge, providing sessions, but to directly to young people in that setting, but also educational settings to staff, sharing our knowledge and experiences. We've got some practitioners that are very influential in terms of referrals into that service, and our child exploitation nurse is one of those. She's got extremely strong links with that service, encouraging her caseload of very complex, high-risk young people to try and access those support services. But also the broader team, where they deem it's relevant and important, they'll too try and engage that young person to access those services. They've been working well in terms of young people accepting those offers. In respect to outcomes and what's that meant for that young person, I couldn't tell you that today, unfortunately. I don't have that level of information, but it's definitely something I could get back to you.
Thank you very much. I don't know if you've considered places where young people congregate, because around this time, if you go to French Gates, you're going to see a lot of them. You know, bus stop, places like McDonald's, KFC, around those places. Just wondering, if it's worth having posters, something that they could just scan the QR code as they're going along and all. So, because I'm thinking that could be a good opportunity to direct them to that opportunity. Thank you.
When I mentioned earlier the three kind of focus areas of the National Drug Strategy and how the Combating Drugs Partnership are responding to each of those, one of them is around young people, so stopping that future generation. Much of our focus has been around, alongside Zone 5 to 19, has been around families where a parent might have a substance use issue, so it's been around how we support families, and that's where our investment has been made. Next Combating Drugs Partnership meeting, which is next week,
Wednesday,
has got a children and young people and families focus. So I think it's been really helpful, the set of questions that you've issued us with today. So I think what we'll do is take some of those considerations, match them to some of our agenda, and discuss as our broader Combating Drugs Partnership as well around some of those elements.
Just add about EPIC. I don't know the service in detail. I'm not as close to it as some of my colleagues, but my understanding through the work that I do with the Safer Stronger Doncaster Partnership is that they have the EPIC French Gate hub, and then they look at need across the borough and rotate where they actually send the EPIC workers out. So they're not in a fixed location. There is a degree of responding to where young people are congregating. Although I do know that happens, I just don't have the precise details of it because it's not in my commissioning zone, but they do move around, yes they do.
Thank you, Ellen.
Could I also add something as well? Just to say that I am aware that we've got posters and QR codes, our Team EPIC do, and Zone 5 to 19 and Team EPIC jointly go into the French Gate during the school holidays where young people congregate, and McDonald's and all those different types of venues. So there are some really considered ways that we try and engage young people. Zone 5 to 19 have been creating their own interactive games to try and encourage people to come and talk to us, because obviously it's not easy to come and talk to a sexual health, substance misuse or school nursing service when you're with your friends. So we try and take out any shyness or stigma that might be associated with that discussion by encouraging them to come and have a chat about something completely different and obscure. But in terms of engagement, that's definitely something that we try and do. And school holidays, unsocial hours, are absolutely something that we consider as part of that communication and engagement plan.
Thank you very much.
Just one last one from me. Could you tell us more about what's in place to support individuals after Project 6 building has closed for the day? And how is modern technology used in providing such support?
Sorry, Helen. So we do have mutual aid groups that use our space on evenings and weekends. And we, Project 6, are involved in different community activities. I'm looking at Ben, you might be able to give specifics. So, for example, we were recently really heavily involved in Pride. We do a quarterly evening event, a sober social event at the space on usually a Friday night. We've had a disco, 80s disco, we've had a murder mystery night, we've had kind of different things like that that's all based on anything like that we do is all co-produced with the community. So we don't tend to work in a way where we put something on and see if people come. We find out what people want and do that. And so if people are saying that they're looking for evening provision, then we do what we can to offer that. Obviously, we're working within the boundaries that we've got in terms of our contracting, our funding and all those things, but we do what we can to be flexible around that. We have consistently every week got evening and weekend mutual aid groups on, but they're hosted at Project 6, not run by Project 6. Obviously, the whole purpose of the AA group is that they're their own thing. But yeah, we've been involved in different evening and weekend provision.
Just to touch on the technology side of things, we've got quite a robust Facebook page. It's used a lot by the people that use the service. They can message there anytime they want, 24 hours a day, and we do pick up the messages as soon as we can. So they have got that kind of, and on the back of that, people have kind of messaged us and we get back to them as soon as we can. So yeah, Elisa's absolutely right. The mutual aid is kind of, we host it, but we don't actually run it, if you know what I mean. So, but the extracurricular, I call them extracurricular activities that we do, are getting more and more because there is a need for outside of Monday to Friday 9-5. So we're doing more and more of those things now. So yeah, it's exciting. Thank you.
Thank you for that. Does anybody else have an additional question? Yeah.
Just to go on to the back of that, one thing evident, everybody relies on you. There was one lady this morning who said, "This is my family. The people within this building is my family." So heartwarming, it was lovely. But I fear for events like Christmas, Mother's Day could be a trigger, you know, Father's Day, things like that. You've mentioned a Facebook group. Is there anything else that's in place over those festival periods?
We're all scrapping with each other to put our hands up. So absolutely, for many different services, there's a kind of a medical-ish, community-ish type model, but also that social model of support and care as well, that is just so essential to keeping people on track, engaged, part of that family, part of that community. So I think Project 6 colleagues are going to come in with some of the examples around some of those particular celebrations or events. But we do have as well working communities through Doncaster and others, including grants for small organisations, and we've connected up across voluntary community faith sector organisations to offer those grants and offer those opportunities out as well. And I think from my perspective as well, now a new kind of organising, arranging structure around voluntary community faith sector organisations, there's chances for us to better join that up and grow those connections as well.
Yeah, absolutely. And we do a lot of preparatory work with our the people that access our services when we're coming up to Christmas is a perfect example. Whenever we're coming up to a particular event or a time of year where people are more likely to struggle, we do a lot of work in the lead up to support them. And again, we're led by them. So if it's something that we're noticing people are raising as a concern, then we'll put on particular groups and particular support that will help them in the lead up. We communicate out anything that's going on within the area or the surrounding communities so that people can essentially have a bit of a timetable of events and different opportunities throughout the period. We close on Christmas Day, we close on bank holidays, but we are open in between, and so still, you know, we run things around it. they are, you're right, I know who you're talking about from this morning when she described us as a family, and we very much have built a really vibrant community, and we know that connection is essential to recovery, and it's something that I'm very proud of us for doing as successfully as we do, but that does mean that the building isn't the thing that makes that work. And so we also absolutely have people who run walking groups together on a weekend, but they met at Sober Social, or who might even have Christmas dinner together, but they met at Sober Social. And we take boundaries with the volunteers and the people who access the service very seriously, and we work very hard to make sure everyone's protected and looked after appropriately while they're looking after themselves in their own recovery journey. But you know, they do build those connections as a community, and so that doesn't have to just exist within our four walls.
Thanks for that, and you're very right. You should be very proud because they're all amazing. It's fantastic.
Can I thank you for all the work that you're doing? It sounds absolutely brilliant and what we need. I'm just wondering how you work within the schools. Is it a pop-up shop, or are you front-facing a class, or are you there for the day to talk to the young people as they pass through the corridor or in the playground, or how is it approached? Thank you.
So a whole raft, everything you've just described, to be honest. Every secondary school has a school nurse drop-in, so an allocated afternoon once a week where any young person can just drop in and talk to a school nurse. But equally, we have got videos that we show in classrooms, talk sessions in classrooms where we'll talk to the whole class. We've got hall sessions where we're talking to a whole year group, or people can choose to engage with us digitally. You know, so a whole raft of different methods. In terms of communication with parents, we'll try and get to parents' evenings. We also have got a parents app where they can log on and ask us questions. So really multifaceted way to try and encourage people to access our service.
Can I say thank you very much? I do appreciate that. Thank you.
Yeah, thank you very much for this morning. It's been very interesting, and certainly the commitment of the staff and the dedication of your service users came across. I think it's fantastic service. I'd just like to ask Zone 5 to 19 really about vaping. I'm sorry, going back to vaping. But back in the day with drugs and alcohol misuse services, we talked about gateway drugs and things. Is vaping now the new gateway to tobacco, cannabis misuse, and leading on to things like that?
It's difficult for me to answer that because I'm not a clinician. However, I don't believe it is. I think we need to probably look at the evidence, and there isn't a lot of evidence around vaping, the effects on themselves in terms of their human body, but also what will happen in the future. So I find that a little tricky to answer, sorry.
I'm grinning towards the back of the room because you've got Victoria at the back there who's working on tobacco and including vapes as well. So I think if you need anything additional around there, I think the concept of gateway drugs is probably an older one now, but again, it will be a newer area. We've been in a newer product as well. Just on vapes and talking about tobacco as well. So vapes themselves can have a role and a place in quitting and in harm reduction. So for adult population, there is a positive role for vapes. What we would never advise is anybody begin to use vapes because they are probably not great for people. But there's Victoria at the back. I'm not going to pull her down, but if there's anything additional, we can certainly provide that as well. Thanks.
Can you explain what support you give to get people back into work once they've been through the detox and the courses and everything they've been? Is there any specific training? Do you have links with any businesses or anything?
Yeah, we do commission Changing Lives to provide a specific model that's for some reason called individual placement support, and it essentially is support into employment. So this is a national initiative wanting to improve the pathway between commission treatment services and work. So we tendered it competitively, and Changing Lives won, and they're co-located with the Aspire team so that everyone who's in structured treatment can get into that individual placement support to get a tailored package of support to get them back into work. So that's one of the things that's been new for us this last 3 years with the additional monies, that we've been able to put that into place as well, so people do get some employment support. And it also includes making contact with local employers and trying to find opportunities for people as well. But my practice colleagues will perhaps be able to say more about how the approach is generally with getting people back into work. But the IPS, as we call it, individual placement support, that's the function of that.
Yeah, so as Helen said, they are co-located with us in one of our buildings, and what they do is they'll go to New Beginnings, which is our inpatient detox unit, speak to clients that are currently undertaking a detox. They'll go to the structured day programme, which is a 16-week programme that some people do following a detox or want to look at what the future holds for them. And we do have a peer mentor training, which is an accredited training programme, which has been led by ADS initially, which again gives someone a qualification at the end of it, and then we work with them. So IPS will go into those groups as well, speak to people in the groups. They also do a drop-in in some of our areas where we're having clinics as well, so that they'll sort of say, while you're here, do you just want to have a chat with Katie, our IPS worker, and she can talk through the placement opportunities or job opportunities that are out there. And also our key workers, when they speak to clients, that they will sort of mention that as well. And we do have posters and information within all our buildings as well, if someone wants to have a discussion around, when they feel that they may be ready for that next step.
I think maybe one of the things Andrea touched on there was the volunteers, and the training is accredited, so it's a national qualification people get. And to give you an example of where that can lead people is they're transferable, those things. Outside Aspire, they mean something to an employer. But we've a recent example of someone who started as a volunteer. Now, the volunteer training gave them the qualifications to apply for a trainee recovery worker with us, a paid post, which they then qualified at. And they are currently now 4 steps above that in the career ladder. So they are a senior case manager now.
I'll just put it on it. I'm so sorry about it. I've been the culprit. So.
That's okay. Any other questions? No? I have one more. And I'd like to give you, for this question, I'd love to give you a magic wand. What more do you feel could benefit the service, and what do you feel is missing?
Oh wow, Helen's wishing for the. So when I started in the introduction, I mentioned that the additional funding that we've received over the last 3 years is fixed term funding. I hope that one stroke of a magic wand will mean that fixed term additional funding will go beyond the 3-year period that finishes this year. Hopefully, I expect you've seen today some of the really positive products of that additional investment, along with the refocusing and focusing on what the core service is and does and where that is. So for me, it would be the continued fair allocation of funding to substance use services. And if I'm allowed one more as well, which I think we made some really positive steps today, is around the stigma element as well. Until a year and a half ago, I'd had small amounts to do with substance services and felt that I had a reasonably okay understanding. I've learnt huge amounts from all the colleagues behind me over the last 18 months or so, and feel that I've got in my DPH role a real strong advocacy role for people at whatever stage they are as their recovery, if they're further away or they're the other side of it, and supporting other people through. So yeah, my other would be that take the experience that you've had this afternoon, those of you that were able to make it to the service this morning, please be voices against stigma, participate, come along to the recovery games, all of those real positive things that Doncaster has.
I just to magic one thing. I think what Rachel says about the funding, the planning and the commissioning landscape is right. It's been very difficult to plan over any meaningful period of time without funding streams that match. And things will be a lot clearer after the budget. And we've been told by the Joint Combating Drugs Unit, which is the Prime Minister's department, that there will be a multi-year settlement. So I've seen that in black and white, so I'm hoping that we will go forward and be able to plan on more than an annual basis. But the stigma is the assumptions, the stereotyping, painting everybody with the same brush and lumping people together like that is really difficult. And try and be positive, I think we've got such strong partnership working now in Doncaster across our formal partnerships and our informal professional networks. I do feel hopeful that whatever happens with the funding, we'll continue to work together in a way that's going to support people as best we can. So more partnership working from me.
Thank you.
Just one last one from me, I'm sorry. What support is there for people who have relapsed? And more importantly, people who have relapsed more than once?
Rather ask a practitioner than a dry old public health person. So, what?
I mean, I think, as someone said earlier, there's never a closed door. So no matter how many times someone relapses, we will always look to start again and support them through our services. And I think having the open access team that we talked about earlier will hopefully get people into treatment, a lot quicker. But we never say no. We never turn anyone away, no matter how many times they've been in service. We'll always try and support people.
So before I go to the recommendations, Rachel, you just mentioned then the recovery games, and if I can give everybody on this side one piece of advice, if you want to see triumph over adversity, my advice is to go to the recovery games. And as the very privileged person who was awarded an award at last year's games that I wasn't expecting, and listening to the description of the person, I was literally standing there thinking, I bet I know her. And I was miles away from the stage, so it took me a very long time to get up to the stage because everybody congratulated me who I passed. But just to say, if I can give you one small bit of advice, and you guys and your costumes are just absolutely amazing and knock it out of the park. But if you want people to talk to you honestly about where they're at and what they're doing, please don't go dressed up. Please don't go dressed up. Join in the colours, dance to your heart's content, and when you all look the same at the end and you're covered in paint, people tell you honestly how they got there and why they're there, because we all look the same. And I just wanted to thank you for this morning because it was wonderful. and I knew I would enjoy it, but we had some real stories this morning, not stories, but people's lived experience of what they'd done and how they'd done it, that was so impressive. And I've been promised a video that I know is going to make me cry, but I will make sure that everybody else gets it as well, because I think that's really important. So our recommendation, this report's for discussion and information for the Health and Social Care Scrutiny Committee members, and we're asked to note the improved access, quality and capacity of the Doncaster substance misuse treatment and recovery system in 2024. So, you know, thank you for that. We are actually now going to look at our work plan for the next whatever, so we don't, you know, bore you to death with our future work plan. I'd just like to say thank you, and you guys can go now before we get down to the nitty-gritty, so thank you. Can I just remind you on this side that when we start talking, we are still being recorded.
Right, everyone, as always, this won't take long, but just looking at the, firstly, the work plan. So, as we all know, today was a really good piece of scrutiny work. We had a site visit, spoke with people with lived experiences, project staff at Project 6 and other professionals and partners in today, and also formally this afternoon, and that's the work around substance misuse. The next panel meeting is on the 28th of November. We're going to have an update, if you recall, the adult social care, your care and support that came previously in July. Before then, although this is just for the chair as representative, we'll be attending the Joint Health Overview and Scrutiny Committee at Sheffield, and they're going to look at an update on oncology and Yorkshire Ambulance Service strategy and services. So if there's anything there we need to feed back, sure we can do that in the next meeting. And final thing to note, in November, either as part of the meeting or after the meeting, there'll be some consideration around dementia, but it might be either a scoping piece of work or a report, and that's just in discussions at the minute. So we'll let you know on that one. On the forward plan, also in the agenda, there's nothing I can actually see as part of the forward plan that refers to this panel. The next finance and performance report for OSMC is in December, that's Q2, so I'm sure there's targets within there that's relevant to the remit of this panel, and as always you can feedback through the chair any questions you might have, and that concludes my bit of it, Chair.
So that officially closes the meeting for this afternoon.